Hi, my name is Dr. Nat Ehrlich, and I'm a naturopathic doctor in Hawaii. I've been in practice here for about a little over 30 years, and I wanted to share some of my thoughts as they pertain to the current COVID-19 pandemic we're having. Today is April 6th, and we are in Maui, where I live and practice. We're having just the beginning of the surge of infections. I think today was our first death that was attributed to a coronavirus infection. And some places in the country right now are getting hit really hard, like New York City. And so to all of those that are in that war against this virus on the front lines, the generals and the infantry, big salute to all of you, to the doctors and nurses and respiratory therapists and orderlies and everybody in the hospitals and the EMTs. Thank you for doing what you do. It's really courageous and heroic work that you're doing. This particular time in my life is probably the time that ironically is most important to discuss the immune system. Optimization of the immune system is at the core foundation of naturopathic philosophy and practice. For those of you who have never heard of what a naturopathic doctor is, we are physicians that are trained to diagnose and treat health conditions and diseases utilizing natural methods. For the most part, the modalities that commonly are used by naturopathic doctors are nutrition and diet, and botanical or herbal medicine, hydrotherapy or physical medicine, which can include regenerative medicine, which is the specialization that I practice. It can include homeopathy and lifestyle. So there's a lot of natural healthcare systems that are utilized by the naturopathic doctor. But at the core of naturopathic philosophy and practice is the immune system. Though what I'm about to share is very important for health and potentially can give people a stronger resistance against potential infection, wouldn't want it to imply to somebody that if you adopt any of these measures that you would not be infected with COVID-19, or that if you were infected with COVID-19 that somehow by doing any of the things that I would suggest, you would somehow not become infectious, because that would be erroneous. But these are still very important, and as the front lines are going to be fought harder and resources will be utilized, including lives, and for lack thereof, the importance of the collective immune system of our country and the world's hive is paramount right now. So the things that we can do to help ourselves in this time actually help the worldwide community, including those who are fighting to help those who are afflicted on the front lines. Over the years, I've seen many things touted as great immune tonics or immune boosters, whether they be foods or their herbs or things that we do or practices we can do to help us stimulate our immune systems. The one thing that remains true to me is that after 30 years, the most important thing is not so much what you take to try to somehow improve your immune system, but it's actually what you don't put in your body, what you avoid ingesting or consuming, that allows for your body to be the best it can possibly be, and to fight and resist infectious diseases, and to be able to maintain that homeostatic process that is in all of life, really, in plants and animals, that regulatory mechanism that keeps us healthy. I look at the body as constantly trying to maintain homeostasis or balance, and when it falls out of balance, the attempt to reestablish this homeostasis looks like what we call disease. The true mission of the naturopathic doctor is to identify this process, to find the cause of that destabilization of this homeostasis, and then correct it so the body actually heals itself. Because we as doctors aren't really healing anyone, we're just supporting the body in healing itself. This is in all nature. Plants, animals, they all heal themselves. And they do it via this regulatory process of homeostasis. I'm going to show you a clip from one of the Democratic debates that happened, I don't know, maybe a month or so ago, in which Joe Biden is discussing his ideas for coming up with cures. This is not in any way, shape, or form political commentary. Here you see Joe Biden telling us about how we're going to spend $54 billion coming up with a cure for diabetes.
Look, one of the things we have to do, we have a thing in the Defense Department called DARPA, special operation thing to find out all the things we have to deal with to make us safer. They came up with the internet, they came up with the whole idea of stealth technology. I'm going to do the same thing at the National Institute of Health. We're going to focus at least $50 billion over the first 5 years on focusing on obesity, diabetes, Alzheimer's, and cancer. And we're going to make that investment because no one else is willing to make that investment. We can, in fact, find cures if we make the investment. And we can get that done. The American people support it. Even Republicans will support it. We have to focus on extending life, saving life, and making people, put them in a position to be able to live longer and more securely.
So I'm not trying to politicize that clip by showing it. Joe Biden is saying $54 or $55 billion for research to come up with a cure for diabetes. And really, it could have been any of those candidates. I don't think they really know or look at health the way I do. There aren't too many candidates that are saying what I would say. Maybe Bernie or Tulsi believe that, but the problem that we're having that's bringing down our healthcare management in this country is related to things that we're eating that is making the overall collective health of our country subject to the notion that somehow pharmaceutical magic is going to come and save the day. And when you know that adult onset type 2 diabetes is completely preventable, the solution is actually very simple. It's not easy. It's not easy to stop eating sugar. It's not easy to stop eating salt. It's not easy to stop eating flour and all these processed and factory foods. Confections are what we get addicted to. And the process of even becoming aware that you're addicted to them is a tough one. You know, sometimes people can come to grips with the fact that they're addicted to sugar, and then you pull out the salt addiction on them, and then you lose them because they don't want to believe that salt's, I have Himalayan salt, or I have sea salt, or it's, to me, it's all sodium. It's just like saying sugar. Oh, you have organic sugar, you have raw sugar, brown sugar. It's all sugar. You're still going to affect your blood sugar levels by consuming that. And it's the same with salt. You can get a little trickle of some other minerals maybe by consuming sea salt or Himalayan salt, but you're still going to get a raise in your body's sodium levels, which ends up having to be adjusted by your kidneys and affects your overall homeostasis. If we look at our species' food sources in evolutionary terms, it provides more perspective. Okay, so here we're going to go into a little evolutionary clock journey. In this particular graphic, the vertical line will represent 1 year. Keep your eye on that 1 year mark. Here we have a group of 10 years, so this is 1 decade. Multiply that times 10, and we've got groups of 10, basically being a century. You group a century together and multiply times 10, we have a millennium. So this is what the millennium's looking like, and you can still see that vertical line times 10. Now we'll have 10,000 years. Now that vertical line, which represents a year, is pretty much vanished. You take 10,000 years, multiply times 10, and there you have 100,000 years. You take 100,000 years and multiply times 10, and this is what it's going to look like. 1,000,000 years. Look at that top left graphic. We consider ancient history about 3,000 years BC up through 500 AD. The green rectangle at the top left of this graphic represents 1,000 years, and the entire grid is 1,000,000 years. Considering that humans have been in existence for 3 to 10 million years or more, depending upon the way you classify hominids, ancient history as we know it is but a thin mark at that point on a grid with 10 million years. And it wasn't until that point in what we would think of as ancient history only a couple thousand years ago, that humans finally started eating salt in any significant amount. And the consumption has multiplied in this last century many times over. Humans have survived for millions of years without salt added to their food. And the same could be said about sugar. However, that would even be even more recently. So sugar has a long sordid history, and that involves slavery, 400 years of enslaving Africans to work brutal conditions, inhumane conditions, to produce an extract from sugarcane in the New World to be imported to basically appease the sweet tooth of the aristocracy in Europe. Later in the 1800s, when slavery was abolished, sugarcane production utilized indentured servitude in the Kingdom of Hawaii and the Philippines and other plantation colonies to further fuel the collective addiction of the growing confections that were being made available to the masses. When sugar prices became more affordable for the common people after the Industrial Revolution, you can see the spawning of the confection industry, such as with soft drinks and candies, all with the designs of hooking people. Here are some of the photos from the dentist Weston Price, who did studies of the effects of processed foods on non-industrialized countries versus industrialized countries in the early part of the 1900s. And he was very much aware of the impact of sugar on not just the teeth, but on the general health of the populations as well. To me, the healthcare crisis that we have going on in this country is not as complex as the politicians are making it out to be. It's actually pretty simple. It's not an easy problem to fix, but it's a simple problem to see, and that is that the things that we think are food are not really food. We've been brainwashed into thinking that when you go into the store and all the things in packages on the shelves, which is really the majority of the stuff in the supermarket, is food, and it's really, to me, it's confection. So easy to lose weight, so easy to get healthy, but you have one huge hurdle, and that is to try to abstain from sugar or simple carbohydrates, the flour, the salt. These are things that are put into confections that are made in the factories in order to get the consumer addicted to their particular brand or product and keep eating that. The parts of the supermarket that I instruct my patients to go shopping at are on the periphery. You know, if you like your poultry or your beef or your fish, then it's on the outside. You just get that. Fresh fruits and vegetables are in one section, and there's not really a whole bunch else that you need to get. Most of the stuff you just get from your farmer's market. And the question of losing weight and feeling good again is actually pretty simple. It might not be easy to do because we're addicted to these things. That's a different story, but it's very simple. And you multiply that, you know, exponentially to get to the place of where this country is and the crisis that we're in as far as healthcare management. We're not going to find a solution to the problem in coming up with some pharmaceutical medicine to cure diabetes. It's not going to happen. What is going to happen finally down the road is when people get smart and they go, okay, we need to actually halt the production of these confections, or make the corporations that are making these foods addictive pay the price or regulate them in some way. But I don't see them paying or footing the bill for the health care that's involved with taking care of long-term diabetic care, because ultimately that's what's bringing down the healthcare systems, taking care of these long chronic degenerative diseases. I mean, we have so many diseases that are related to the things that we eat. These things are all completely manageable with diet, and yet by the time you're 50 or 60 years old, you've got 5 or 6 pharmaceutical drugs that you're having to take, and you're going to have to take them for the rest of your life. That's usually when people come to see me, and what they want is just a natural remedy for that. The natural remedy being some pill that's an herb or a tea or something. I'm just trying to, recite which law of physics is it that I'm going to use that particular. What goes up must come down. Matter cannot be created nor destroyed. This is the law of cause and effect. These are the principles that are involved. You don't just magically dissolve miles worth of plastics that are in the middle of the ocean floating out there. This is the same with our body. Our body is ecology. We've polluted it for decades, and now all of a sudden you want to take a pill and make it all go away. It's just an herb. Oh, it's natural. No, it's not the way it works. It goes back to the very basics, and that is not so much what you're going to take as an herb or a supplement to make yourself healthy. It's going back to eating only the foods that we are designed to eat, and part of that involves our evolutionary history with foods, and that in and of itself is hard to understand, because if we don't understand time and how our bodies and we as an organism evolved, we won't understand that we're not equipped to be able to handle the confections that we're putting in our body, and you can't just expect some magical pharmaceutical drug to do the trick. I put all of my faith in our immune systems and this ability of our body to heal and regulate itself, and to support that. But in order to support that, albeit it's a very simple formula, it is very difficult. I understand that. Things that people don't understand is that we are designed to have a very complex immune system that maintains and does all this automatically for us. But when you do things to challenge that immunity, meaning constantly putting things into the body that were not designed to be eaten, or exposing yourself to noxious chemicals or fumes or cigarette smoke, for example, of course eventually the body's going to break down, and there's nothing that's going to heal that. So one of the easiest ways of thinking about this is what's natural. What is natural? To me, natural is something that it's in its whole form, the way it grows, not after it's been taken down, skinned, milled, bleached, added different types of preservatives and colors to make it look sellable. It's in the form that it was when it grew. And it should be organic, obviously, and filled with nutrients and all the goodness that would be growing in ground and soil that's healthy. So when you look at what this is, Some people call that natural if it's brown. To me, this just looks like a drug. And it is. It has that type of an effect. It should be considered a drug because it has that strong of an impact, immediate impact on our blood sugar. So when your body can't assimilate any more sugar because we've found a way to concentrate sugar into such a strong dose that our cells are finally saying, no, that's enough, we can't have any more, yet the pancreas is still trying to generate and produce more insulin, and we start getting into the problem of hyperinsulinemia and metabolic syndrome. And these are basically homeostatic issues that are trying to regulate a problem that would not occur in nature, because you're not going to find this in nature. So the problem with sugar is that it's insidiously become part of all the foods that we buy in the store, in restaurants. It's almost impossible to get it out of our food. Even if you go to the health food store, the natural food store, albeit it might be called organic or evaporated sugarcane juice or something, it's almost in everything. And the same is for salt. Almost universally, I see this when I put patients on cleanses or detoxification regimes, and though at first it's challenging for them to eat foods that they refer to as having no flavor, ultimately because there's no sugar or salt in them, after a few weeks, they go back to trying to resume what we would call normal foods, and they can't even eat those foods because their palate has recalibrated. So, for example, a corn chip that is salted and now after the cleanse almost burns their tongue. It would require that we not only stop adding sugar and salt to our own meals that we prepare, but it would also require that we, as consumers, demand that food is prepared for us, not doctored up with salt and sugar. And that will require that we acclimate our taste buds to the way foods are supposed to taste in their truly natural state, and dispel the notion that somehow salt brings out the flavor in food. Actually, what salt does is hide the flavor of food. We should be able to distinguish how fresh our vegetables and fruits are in our prepared meals, but most of the time we can't, because the true flavor and how fresh or old that produce may be is camouflaged by the overpowering of salt and sugar. We know that sugar consumption can reduce white blood cell activity, so when you eat sugar, you're basically weakening your immune system. Some of the over-the-counter remedies that we use for pain and inflammation and reducing fever, like non-steroidal anti-inflammatories, turn out to be not such a good idea. I've always thought this and known this, especially because, as I said earlier, I practice a lot of regenerative medicine, and along with the post-procedural instruction, I always give the advice to patients to not take any ibuprofen or not do any of these anti-inflammatory medications like aspirin. And there's a reason for that, and that is because they impede the action of the COX-2 enzyme on the synthesis of prostaglandins from arachidonic acid. And because they're COX-2 inhibitors, and they inhibit this enzymatic activity, the prostaglandin synthesis doesn't occur. Prostaglandins are what mediate pain and inflammation and antibody formation and fever. So this entire family of immune response is actually pertinent to resistance of infection, to regeneration and repair of connective tissue on trauma, and the growing and the strengthening of your immune system by building antibodies. So when you take non-steroidal anti-inflammatories, we call this a suppressive treatment. In the initial phase of your problem, let's say you twisted your ankle, so you have a swollen ankle and it's painful, that ibuprofen looks like a great idea, right? It reduces that inflammation, it takes the pain away. In people who've got fever, it reduces the fever. But doesn't it seem that there's some evolutionary significance to having these actions happen by the body? Fever, for example, we know is very important for reducing the chances of any kind of invading microbe to replicate. So at certain temperatures, virus can't replicate, or the bacteria or fungi can't replicate. So we know that fever actually has an evolutionary long course of history in allowing for the organism to survive. It's not just fever, it's also with inflammation. It turns out that that inflammatory cascade that's occurring is actually very important for the eventual repair and regeneration of normal connective tissue. So if you tear a tendon, even though initially it's swollen and, for example, you can't walk or whatever it is, down the road, you're going to heal if you allow it to heal. If you take ibuprofen, or as we say, if you want to make an acute injury, a chronic injury, put ice on it or take ibuprofen, then these are the things that we start to realize that are natural, evolutionary, homeostatic regulating events that have to occur. And the wisest approach is to not impede that by taking nonsteroidal anti-inflammatories. This article in the Journal of Cell Immunology from 2009 studied the effects of nonsteroidal anti-inflammatories on immune function and showed that ibuprofen reduced the production of antibodies due to its COX-2 inhibition. On March 17th, the French health minister had stated that taking ibuprofen or corticosteroids could be aggravating COVID-19 infections, and this was then rebutted by the FDA, stating that there is no evidence against the use of NSAIDs or corticosteroids in COVID-19 patients. But given the lack of studies, caution should be given to prescribing NSAIDs or corticosteroids for COVID-19. And as a result, people with COVID-19 in their latter, more serious phases of the disease can experience a cytokine storm, which can result into their final demise. So once again, we're learning that suppressive treatment is probably not the best approach. And here we are in Bami Pukalani, where the temperature is about 145 degrees Fahrenheit. Now that's inside, because I'm in a sauna, but I wanted to give you some of my feelings about saunas. Saunas have been used safely by a lot of the Scandinavian cultures for centuries, used by many other cultures, and for the most part safe. However, I wouldn't do a sauna and go to high temperatures at all if you were suffering from high blood pressure or any kind of potentially emergency cardiovascular situation, aneurysm. One of the things that saunas have been shown to do, and I'm going to show you this study from a Finnish study done on sauning and alternating hot and cold. And that's what I'm actually doing. I'm going hot to cold. And that is that the hot and cold actually strengthens the immune system. The results of this study compared Finnish sauna, which includes 15 minutes of sauna bathing at temperatures of averaging 96 degrees Celsius, followed by a 2-minute cool down with water at a temperature of 20 degrees Celsius between athletes and non-athletes. And overall was shown to increase white blood cells with a greater increase in the athlete group. This is an interesting article, I thought, as it harkens back to the clip I shared regarding Joe Biden's debate, in which he's wanting to spend $50 billion on research for diabetes and also said Alzheimer's, and here we are. This study compares sauna bathing in Finnish men, and it, as a population-based study, showed that in Finnish men undergoing moderate to high frequency of saunas, they were associated with lower risks of dementia and Alzheimer's disease. So time and time again, I've seen the body find its own path to healing, and this in spite of many obstacles that we seem to put in its way. I do think that the solution to our healthcare crisis in this country is very simple, and it's actually a worldwide problem. Factory foods are not just here in the United States, but it's big business and it's spreading across the world. The execution of the solution is going to be the hard part. Getting people to stop and somehow do away with the addictions to sugar and salt. But once that happens, things are going to change in a big way. So as we're discovering with the coronavirus pandemic, is we are all inextricably connected to one another. Here on the island of Maui, in the state of Hawaii, in the country, in the continent, from continent to continent, it's turning out that we can't deny that we are all one tribe. And that said, let's push forward, let's be a better humanity, and take care of yourselves. Aloha.
It's up to